Thank you very much. It is a true pleasure and honor to be in front of you today. This is my dream job, honestly. I did a PhD, so I just spent a lot of time at the bench, but now I get to teach. But the cool thing is I still have to do research. I do research into how other people learn, such as yourselves, and I have to teach things that, a PhD, a lot about a very small topic. So I have to broaden my knowledge and then make sure that I am teaching at the level that you need to know as physicians at this particular moment in time, and then moving forward and making you competent learners. So as we've heard before, making sure you know where to go to find the answers, but you'll learn most of them from me in the infectious disease, don't worry. So one of the things that I like to focus on is what we call alternative approaches, because when I sat in my very first med school lecture and looked at the students, this was what I saw. They're excited, and then more material comes, and then we're 20 minutes into the lecture, and then more material comes, and then by the end of the lecture, they just, the heads are exploding. They take a 10-minute break, and then we do it all over again, because there's just so much information. And so if you learn it piecemeal, you can't make the connections. You just go home and you don't have time to cook. You're eating ramen noodles and you're just studying and trying to put things together. And so one of the things I want to do is eliminate this. I also love cats, by the way, so that's why this is in here. But that's why I wanted to try and find some alternative approach. And I don't think that I'm necessarily inventing anything new. This approach has been around. It was even suggested in the New England Journal of Medicine, and some med schools have done this with entire courses. And so one of the reasons I flip is that the learning can take place anywhere. Who here likes to listen to music and or the news? Okay? So just shout out some places where you do that. Where do you do it? In the car. Where else? The gym. Okay, walking between classes, just kind of hanging out at home, right? Maybe while you're making breakfast or dinner. The wonderful thing about that is that you can learn doing any of those things because you're listening. You're listening to the news, whether it be your local news or NPR. You're learning when you're doing that. There's no reason that you can't listen to the material that I want to give you while you're doing that. I wouldn't recommend it maybe right before bed because you might go to bed a little earlier than you want in some cases, or some of the things just aren't, things you want to be hearing about right before you go to sleep. So the cool thing is you're learning at all of those times, so the learning can take place anywhere. And the other reason is that reading one textbook, I don't know that that's not where things are going. So who here, for the students here, who here use something other than their textbook to study for any course in college? Right? So your professor says, this is the one thing you need. This is the one thing that I think you need, that plus my lecture notes, and you're good. Was that always true? No, because there are a lot of different ways to learn. And so one of the things that I like to do is provide the information, and you can listen to it at the gym, in the car, between class, hanging out with your cat, wherever you want. Okay, and then when you come to class, I don't even call them lectures anymore, I call them large group sessions. That's where we learn to make the important connections. We reinforce the concepts. And then I'm going to challenge your knowledge. So by the time you're done with me, you will know what you know, and then you'll know what you don't know. So by the time you get to the test, the anxiety for Higgins stuff isn't there. Because he's already told me what I need to know, and he's already challenged me. So I provide the information in the form of a podcast. So this is something that more and more professors are doing. I've seen a lot of interest from some of my colleagues, some folks that have been here. There's one woman who I have to point out who's been here for over 30 years. It's her final year of teaching. And she said, I want to try this podcast thing. I think it works really well because she's seen the response that I get from the students. It's her last year. This is when people mail it in sometimes, They just show up and just bring their slides that they've been using, or their overheads if they've been here for a long time, and they just go. But no, she's like, I want to try this. This is intensive. This takes a lot of work on the part of the faculty, but I think it works well. Okay, and then I can just do it right in my office here. Oops, sorry. Right in my office, and and it works out really well. I have a little tablet. I can draw. I can point things out. My voice, however, is not the greatest, but the students don't seem to mind. I've tried to get somebody with like a Morgan Freeman voice to do it, but I haven't been able to find anybody. But then when you show up to class, we make it fun. Because one of the things you heard before is that you're going to work together as students, and that is so crucial. If you can teach it to someone else, then you know it well. And that's what these students are doing. They're looking at a case, and they're working at it together. So one of the cool things about this point is up to this point, they've had a podcast from me, then they're working on a case, but there's one thing they haven't had yet. That's a didactic lecture, and they're not going to get that from me. They're going to get a podcast with everything I think they need to know, and I do my best to explain it. But the reason that I even show up is because now people have questions. Sometimes things need to be explained better. They say, Higgins, sometimes you mumble in your podcast, or I fell asleep halfway through, whatever. But now I can explain it to them, and we can make those important connections. And so one of the things we do then is they've all had the case, they work in small groups, and then we just go over them. And the really cool thing is we have some wonderful groups, and they have these wonderful group names, and it works out to be a lot of fun. Notice also in these pictures, the laptops are all closed. So you don't even have to take notes during my session if you don't want to, because everything you need to know is in that podcast. If you want to take notes, that's fine, but when we do these cases, they're all from here. I want to know what you have retained from my session. So if you have it up here, you're good to go. Now, if you want to take notes, that's fine. But then one of the things we do after that is we go through some questions. And you say, well, questions are kind of boring. Are they even fun? You know, you've heard about the boards and how important they are, so I make all my questions board style so that you're familiar with it. So by the end of your second year, you will have had several hundred questions from me in infectious disease and microbiology. So by the time you get to boards, I remember, Higgins taught us this. I remember this. At least I hope you're saying that and not other things. But with the questions, we make it fun. We make it a game. So when we did skin infections and wound infections, some of you might recognize this as the Iron Throne from Game of Thrones. We also did a Battle of the Sexes when we learned about sexually transmitted diseases. So we had all the men on one side, all the ladies on the other. And it was quite a heated affair, all the way to the point where it came down to the last question. Is the volume up? So the men happened to win that particular game. Humble in victory, as always. So the men happened to win, but the ladies have already requested a rematch, okay, likely when we get to GI, because they knew the next session coming up was the respiratory pathogens. And there are a lot of bugs when we get to respiratory. Okay, so what they wanted was something I'm calling unplugged. We're going to skip the cases up front because that's what they asked for, and we're going to go through questions. And you're asking yourself, why are you just going through questions? What does that teach us? It gives us a question and then the right answer. So let me show you. Now the problem is, as I've described, I usually give you a nice podcast ahead of time. And then we go ahead and review the material from the podcast, but you haven't had one yet. I sent one out, but I don't think it got to everybody's inbox. So what we're going to do is we're going to use our life experience as the podcast. Okay, this is going to be someone that presents with symptoms that I know a lot of people are familiar with, especially the parents in the room. So let's, without further ado, so what you're going to do is read through this. Okay, so we have this 31-year-old woman. She presents with fever, muscle aches, runny nose, and a non-productive cough. So she coughs, but there's no sputum coming up for the last 3 days. Okay, she hasn't traveled anywhere recently. She's the mother of 2 children. Okay, she has a high temperature. And based on this information alone, you should be able, or you will be able to, I should say, by the time you've had my podcast and we go through the session, pick out the correct answer. So what I'd like you to do is just take maybe 20 seconds or so if you'd like to converse with those around you. Those of you that have clickers, please click or choose the response that answers the question that you think is correct. And the organisms are listed here, and these are the things that you might have heard of that they cause, the conditions they cause. How many clickers are out there? Okay. Oh, they're talking. I'll take it. Okay, so if you have any lingering doubt, remember these are anonymous. They're not linked, don't worry. I always make them anonymous. I care more about what you know by the end of the session than during, but I think it's important to challenge one's knowledge during the session because the way a didactic lecture works is you're trying to both take notes, listen to the professor, and then learn the material because at the 20-minute mark in a lecture, if you don't understand what happened at the 10-minute point, at the 20-minute point, you're going to be in a little bit of trouble. So with a podcast, you can stop it, rewind it, listen to it at 2x speed. I've heard I sound a little bit like Alvin when they do that. But a 20-minute podcast, 10 minutes and you're done. Okay, and you can take notes. And I don't read from my slides. I do a lot of drawing. Not good drawing, but a lot of drawing. So we will go ahead and stop the polling, and we will see where folks went with this. Wow, wonderful. Okay, so we have a lot of people going towards influenza. So let's go ahead and just kind of go through these really quick. So who here has heard of whooping cough? Okay, does anyone know what age group would most commonly present with something like whooping cough? Right, babies, children kind of thing, right? And they're heart-wrenching to watch, but if you've seen either like a YouTube video or in person, they have this long cough, right? And that's where the whoop comes from, is when they're trying to get the air back in, okay? Because the bacteria is actually causes something where they can't actually get the air back in. Okay, so they cough, 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 and they have to do this, and that's where the whoop comes from. Okay, so we don't really have anything along those lines in this presentation. The age isn't quite right, and the clinical manifestations wouldn't really match up. So we're gonna put this kind of down on the list of possibilities. Now, Ebola. Okay, I see some folks are still a little worried about Ebola. Okay. All right, now I understand in the news there have been several instances where medical centers have interviewed a patient even that came back from, I think it's West Africa, and sent them on their way despite their flu-like symptoms. We don't have that here. Our folks, I know, I get the emails and sat in on the training. They know. Don't worry. Okay, so one of the things where you really want to suspect this, it's not just the flu-like symptoms, it's also with some kind of exposure history, right? So we not only have that she reports in a recent travel, she's not getting out a whole lot. Okay, so this question is really pushing you away from Ebola, right? Okay, so the question will have everything you need to know in it, both for the correct answer and then the non-ones. So with Ebola, we are touching, we're going to go away from that. Now, histoplasmosis. Who here has heard of that? Where's the capital of histoplasmosis in the world? Kentucky. We're number one, right? So, histo is, it's on the differential, someone coming in with, you might think some kind of chest issue. However, this is a rather rapid kind of onset. So 3 days ago she was fine, and all of a sudden, fever, muscle aches, boom, cough. Okay, now with histo, where do you get histo from? Like the soil, right? So if this was, even like a 35, 36-year-old woman who was a farmer, a landscape architect, something like construction, then you might think, because then you're digging up a lot of earth and taking in those spores, because this is what kind? Bacteria, fungus, virus, or parasite? It's a fungus, right? So this is a bacteria, this is a virus, now we have a fungus on our list. Okay, this is also much more common. It can happen in folks that are immunocompetent, but this often will occur in the context of immunosuppression. Okay, so we don't think it's cysto. A lot of people thought it was influenza. Okay, now this might have just been an opportunity to use a topical organism that's in the news a lot, and for those of you who did that, good for you. Okay, because this is in fact what we're going for. Now, influenza again is a virus. Now, rhinovirus, why did you go away from a common cold, for those of you that didn't choose the cold and chose influenza? The fever, exactly. Okay, so rhinovirus, you would see the runny nose, and that's might have been what pushed some people off there, because there's no real age group that has the monopoly on the common cold. I had one like 2 weeks ago. So that doesn't push you, but the runny nose, but we have that fever and the muscle aches. Okay, if you had fever and muscle aches with a common cold, we would have found some way to cure it by now, right? Okay, so we're going to go against that. And then we have strep pneumo, which causes a bacterial pneumonia. Okay, now, for those of you that didn't go with strep pneumo and went with influenza, why didn't you go with bacterial pneumonia? The non-productive cough, exactly. You tend to cough things up, right? So you can see here, the wonderful thing about this integrated curriculum is that when I teach, there is no virology block, mycology block, bacteriology, and parasitology. It's all together based on a presentation. As Dr. Fedock said, a patient is not going to come in and say, "Doctor, I have influenza." They're going to say, "Doc, I have a fever, I'm burning up, I'm coughing, but nothing's coming up, and my muscles hurt." That's it. That's all they're going to say. Okay, and they'll probably also tell you a lot of stuff that may not be relevant to this, but when they get in the doctor's office, they want to make sure they say everything, right? You want to get everything down. So you have to filter through that. So what you're seeing here is now we've integrated the key aspects of infectious disease into one question. And now the key thing is that you've not only learned how influenza presents, but now each and every one of you has learned something about these organisms. Okay, not as much as you'd learn from me in a classroom, obviously, but still, you've learned a little bit about each of these. And that was in a relatively short period of time. So that, I think, is the power of the flipped classroom, and I'd like to thank you very much for your time.